Hello, my name is Murilo Matos de Barros, and I'm gonna present today my research study of variables related to pulmonary thromboembolism in hospitalized patients with COVID-19, a literature review. My advisor in this research is Professor Fábio Teodoro de Souza, and I study medicine in Curitiba. The pandemic caused by SARS-CoV-2, starting in early 2020, makes its studies of great relevance, since science needs to act immediately in an attempt to combat the disease and the deaths caused by it. Among the various causes of death and sequels, thromboembolic complications are important causes of these events. Thus, there is a need for information that helps to characterize possible variables associated with pulmonary thromboembolism, PTE. The main objective of this research is to identify possible risk and protective factors for the development of thromboembolic events in patients with COVID-19, with major focus on pulmonary thromboembolism, and thus assist health professionals in better managing patients by allowing greater prevention or earliest possible diagnosis of this complication. To do this research, an electronic search was conducted in the PubMed, Cielo, and Virtual Health Library databases with some specific descriptors. After that, the studies were individually selected to obtain the final articles that we used in this research. During the review, it was possible to observe some factors that increase or decrease the risk of patients presenting PTE and death. They are higher patient severity confers an increase in thromboembolic events. This is comparing ICU patients and other wards. Prophylactic anticoagulant dose reduces inpatient deaths, preferably low molecular weight heparin. Advanced age, obesity, immobilization, smoking, and other comorbidities that before was already a risk factor for PTE, now it's still risk factor, even COVID-19 and PTE happening at the same time. Elevated D-dimer as an important diagnosis marker and indicates increased risk of need for ventilatory support and mortality. Elevated troponin levels are also related to poor patient outcomes, although its differential diagnosis is broad. The present study attempted to make a review about the topic COVID-19 and thrombotic complications. In general, the study aimed to provide data for a better understanding of the aforementioned phenomenon, and consequently, to assist in the development of clinical and therapeutic interventions of the problem. Therefore, more good quality studies and research on the subject should be conducted in order to further understand its physiopathology, the interaction between COVID-19 and thrombotic disease, and thereby improve diagnosis and treatment. Thank you.